Welcome back at 7:13. Stress is simply a part of life, but consistent periods of high stress can negatively impact your health. Dr. Brent Wallis with People's Health joins us now to explain the difference between just regular stress and chronic stress and the best ways of managing it. Dr. Wallis, good morning. Thank you for being with us.
Good morning. Thanks for having me.
So let's start off with that very question. I know most people feel stress during the day at some point or another, but what's the difference between just your regular daily stress versus chronic stress?
Yeah, so, there really are two different types. Stress is really anything that can cause, a physical or emotional strain on your body. Acute stress is actually very common and everyone has it. It can actually be something good for you. The stress you feel when you're driving in a thunderstorm may keep you more alert and, eyes on the road and everything. Chronic stress is something different. It's kind of a lower grade type of stress that you may feel all the time, and you may not even realize that you're having it when you are.
And that is the one that really can cause you problems. Again, you can deal with the day-to-day stress. We're showing some video of people meditating, doing yoga, some breathing exercises. That can kind of help you calm down when your day-to-day stressors are hitting you. But chronic stress, if you don't manage it, can cause serious problems. What are we talking about when we say that?
Yeah, exactly. Chronic stress, like I said, it's really this constant feeling of being overwhelmed or under pressure. It can actually have a lot of physical manifestations. Some people may have trouble sleeping. They may experience feelings of sadness or anxiety and a decreased energy level. And, some will even develop aches and pains. And so if you're having any of those symptoms, it may be something more serious that you need to talk to your doctor about. So that's why it's really important to talk to your PCP and see what your options may be.
And I know it depends on each person, but what are some of the options out there when it comes to treating chronic stress?
Yeah, chronic stress in particular can lead to a lot of physical health problems. It can lead to insomnia, depression and anxiety, even high blood pressure and heart disease. So, so some of the things you want to do to try to relieve stress is really focus on three main things. Exercise is critical. That's definitely something that helps reduce stress. Sleep is also very important. Making sure you get at least 7 to 8 hours a night can really help alleviate stress that you may be having. And then diet is very important as well. You want to make sure you're eating a very nutritious diet. That's going to help your body stay a lot more healthy.
And if people are dealing with those day-to-day stressors, any suggestions you have for them? Like I said, we were showing some video of people doing yoga, breathing exercises, outdoor activities like fishing. I mean, I don't think people realize how those tiny little things or activities really can go a long way in the day-to-day. Of course, if it's a bigger issue, chronic, you do need to speak to a doctor, but those day-to-day managing stressors, options, tools really do go a long way, right?
Yeah, absolutely. We call that active stress management, and there's a lot of things you can do. Spending time with your friends and family, as long as that doesn't stress you out. And, relaxation techniques, like you mentioned, yoga is very good. But hobbies are really excellent. They get your mind off of the day-to-day, things that may be causing stress in your life. And they are really important. They're actually good for your overall physical and your mental health.
Well, Dr. Wallis, as always, we appreciate your time. Thanks so much. Have a great weekend.
Thanks, Kelsey. You too.